When people hear the word ketamine infusion and ketamine infusion therapy, a lot of things come to mind. And I asked my wife what she thought it meant, and she thought it meant something completely different than what I thought. So, with me, as usual, I have Fraser Johnston. Fraser pioneered the Odyssey method, which is a structured, holistic approach to psychedelic assisted therapy. Fraser is also the CEO and founder of Entheomed, which is one of the world's leading clinics in psychedelic assisted therapies. So, Fraser, could you shine some light on what ketamine infusion is? And are there different types of ketamine infusion? How is ketamine really administered in a therapy situation like what you provide with the Odyssey method?
So a ketamine infusion is usually what's associated with the category of ketamine-assisted therapy. So a ketamine infusion is a medically supervised way of delivering ketamine at a controlled dose for a therapeutic treatment. So usually the word ketamine infusion is associated with either intravenous delivery or intramuscular delivery of the medicine.
Intravenous or intramuscular. So you said these two different words. What does that mean for someone like myself who is not in the medical space at all?
Yeah, so an intravenous infusion is where they would put an IV line into your vein, usually at your elbow or in your hand here. Intramuscular is when they would do usually a single injection into the glute or the deltoid, and sometimes they might do a top up intramuscular injection. Maybe 20-30 minutes during treatment.
So the intravenous one, would that be like in your arm the entire time you're doing that ketamine therapy, or does it like go in and administer, then it hits later? How does that work?
Yes, so from my own personal experience, Mark, and then even chatting with a lot of our clients, is they much prefer the intramuscular experience. So if you are doing an intravenous infusion, that IV is left in for the duration of the treatment. So me just personally, I always get a little grossed out with IVs. So I just much prefer the one and done intramuscular injection.
So the intramuscular injection is it's a needle then, like with a dose in it.
Yeah, for sure. So it's kind of like it's a pretty like baby needle, and they'll just go into the muscle, usually glute or deltoid.
Yeah, I think for myself, I would way rather prefer that, is because even when I'm at the hospital, like I have the IV in my hand, like I always feel like weird. I like don't want to move it too much, and like it just is. You're right, it's not comfortable. So is that what you guys administer? Then you guys do only in the intramuscular, in the muscle one, with the Odyssey method?
Yeah, absolutely. So for us right now with just regulations and guidelines within Canada and specifically BC, we specialize in intramuscular ketamine. So with the intramuscular ketamine, you still have very precise dosing and monitoring during the treatment. It is a clinically safe space. So the bioavailability of intramuscular ketamine, they say, is like 98%. And the bioavailability of IV ketamine is like 99%. So you're still getting as much of the medication in your system as possible.
I see. Is there a reason why people would do the IV one? It seems like the intramuscular one's a no-brainer.
So with the IV, so it's interesting. So the intramuscular experience, when that injection is delivered, you maybe have about 2 to 5 minutes till the onset begins. And I always say, Mark, it's like the rocket ship. So, and there's no getting off the roller coaster. Whereas with intravenous ketamine, you can like titrate the dose in. So you can kind of build the ketamine up in your system a little slowly and more smoothly. Whereas that intramuscular ketamine, you have that very like rapid onset, and you can't get off the cart once it's going.
And could you just quickly give a brief overview of the ketamine assisted therapy and what the Odyssey method is? Like if you were to lay out, 3 steps, 5 steps that the Odyssey method has, what are those steps?
So first and foremost is the intake, Mark. So we do a mental health screening and a physical screening with all of our clients to make sure they are safe and suitable for treatment. The next step is the preparation therapy. So that is working with, a certified psychedelic therapist to really help you prepare for that treatment and set an intention. At that point too, our clients will also use our app Odyssey Online. So there is a lot of educational resources in there and other, healing modalities like breath work and meditation and yoga that we encourage our clients to really build a daily practice with to help them regulate their nervous system. Next step would be the actual treatment in clinic. So you come in for your treatment, you're medically supervised for the duration of that, and comfortable living room like environment. And so usually someone is in and out of the clinic in about 2 hours, and the intramuscular experience I'd say ranges from about an hour to an hour and a half depending on the person. And the final step is that integration therapy after treatment. So really working with the therapist that you saw for the preparation therapy to help you unpack that psychedelic experience. So any insights that came up for you, any emotional things, any visions, to really help that you integrate that into your normal life and create the proper, behavior, habit, or thought pattern change that person's looking for.
That's amazing. Thank you. If you want to get started with the Odyssey method, talk to your doctor, and also use the link down below this video where you can download our full guide or also book an actual call with one of the doctors at Fraser's clinic. And of course, subscribe to the Odyssey method with Fraser Johnston right here on YouTube, and leave us a comment. Let us know what videos and what topics you want us to cover, and we'll see you in the next video.